Blended Podcasts. Brought to you by Blended Audio.
What does a healthy, balanced lifestyle consist of? How should you eat? What exercise should you be doing? How many hours of sleep do we really need? Does too much water flush away all your vitamins? Should it be high carb, low fat, or high fat, low carb? The more research you do, the more confusing it gets, because there is so much information out there, and there are so many conflicting opinions. So how are we supposed to know? Stick around to explore the different approaches to health with us, physically, mentally, and emotionally, and let's try to figure out together what the heck being healthy really means. I am your host, Hazel Priscilla, and this is your weekly dose of Feed Me Honesty. Hello, curious cats, and welcome back. A big shout out to those of you who have been tuning in every week so far. Now, you may or may not know this, but November is Diabetes Awareness Month. Globally, the 14th of November is known as World Diabetes Day. That's why I thought it would be fitting to get dietitian Pietra Low on the line to tell us everything about this topic that she can possibly fit in 25 minutes. Especially since she just got back from a 3-day diabetes forum. Pietra Low obtained her Bachelor's of Dietetics degree, which also includes her honours degree, through the University of Pretoria, after which she did a year community service at Standerton Hospital. She is also a D-analysis practitioner, accredited CDE practitioner, and OptiFast dietitian. And earlier this year, Pietra spread her wings and opened her own private practice called NutriCore. Pietra, welcome to Feed Me Honesty, and thank you so much for your time.
Yes, so hi everyone, and thank you so much for that introduction and for having me today. I'm very excited to talk a bit more about diabetes.
I'm pretty sure we are all familiar with this condition, but basically what diabetes means is that the pancreas fails to supply enough insulin, or the insulin doesn't work properly, which results in high blood sugar levels in the body. Correct me if I'm wrong, Pietra.
No need to correct you on that one. That is basically what it comes down to. Before we start off, I would actually like to mention just one thing, and that is that diabetes is not a disease. It's a medical condition. And obviously, at times, it's difficult living with diabetes. So these people really require support from the community, the public, friends and family. So please don't go around treating individuals with diabetes any differently than you would treat someone without diabetes. And people with diabetes really have a lot to deal with. So just please be there for them and support them through their diabetes journey.
I think a lot of people are under the impression that diabetes is directly and only related to eating too much sugar. Can you please explain to us what the most common causes of diabetes are? How big is the role that sugar really plays in this equation?
So I'll start off with type 2 diabetes. And genes and the environment are basically the two major aspects that increases your risk of developing type 2 diabetes. So when we look at genetics, family history plays a major role. But it's important to note that we are talking here about first-degree relatives, so either a parent or sibling. And family history in type 2 diabetes is actually quite usual, common. Just to give you an idea, your chances of developing type 2 diabetes, if you have a parent with diabetes, is 50%. A sibling is around 33%. And then a parent and a sibling is 75%. So you actually have quite a high risk of developing type 2 diabetes in that case. But other than genetics, we also look at the environment. So this includes your lifestyle factors, such as being inactive, not exercising, having a poor dietary intake. So a poor diet is where the sugar aspect that you mentioned will come in place, of course, but eating too much sugar is definitely not the major or the only risk factor of developing type 2 diabetes. And I think it's very important to note that eating too much sugar simply plays a very small role, but obviously we all know eating too much sugar is not good for us, and yes, it contributes to having a poor dietary intake. which is a lifestyle factor that can increase your risk for developing type 2 diabetes. Then on the other hand, obesity. So eating too much sugar will obviously also result in weight gain if you're not managing your dietary intake, and weight gain can lead to obesity, and obesity is a major risk factor for developing type 2 diabetes. Also age, just by being 40 years or older, you're already at high risk of developing type 2 diabetes. Pre-diabetes, or like we'd rather refer to as intermediate hypoglycemia, it's basically a stage between not having diabetes and being diagnosed with diabetes. So this is obvious that it does place you at a high risk of developing type 2 diabetes later in life, as well as a history of gestational diabetes. So that is when you have diabetes during pregnancy, but only for that period of time. So after pregnancy, you're perfectly fine again, no diabetes afterwards, but you will always then have that increased risk of developing type 2 diabetes later in life. And then lastly, race or ethnicity also plays a role. So in South Africa specifically, non-Caucasians are at a high risk of developing type 2 diabetes. Then when we look at type 1 diabetes, actually we don't really know what the cause of type 1 diabetes is, and we refer to it as being idiopathic because of the cause being unknown, but it is an autoimmune disease, and obviously genetics plays a role. The family history though is not as common as in type 2 diabetes. So in this case, I'll give you an idea. So your chances of developing type 1 diabetes with a mother who had diabetes or have diabetes is 1 out of 100, and a father with diabetes is 1 out of 17. A sibling with diabetes is 1 out of 30, and then a parent and a sibling is 1 out of 10. So the family history, you can obviously see why it's less common when you look at that ratios. But to have or to be diagnosed with type 1 diabetes, you do need require a pre-existing genetic component that needs to be present. So genetics does play a very important role in the development of type 1 diabetes. And then obviously also age. So as you know, type 1 diabetes is most commonly diagnosed in children, but it can however occur at any stage or at any age.
Can you tell us what the differences are between type 1 and type 2 diabetes?
Of course, so the major difference between type 1 and type 2 diabetes is that in type 1 diabetes, we have what we call beta cell destruction, resulting in an absolute deficiency of insulin. So you don't have any insulin produced by the body at all, and obviously this then leads to high blood sugar. Whereas in type 2 diabetes, we're only looking at the beta cell dysfunction, but that results in insulin resistance. So you do still, however, have some insulin produced by the body, but you're insulin resistant, so it's not doing what it's supposed to do, and then that also leads to high blood sugar. Just a few other things. In type 1 diabetes, you're prone to having high levels of ketones, so ketosis or ketoacidosis, and like I mentioned before, it's usually diagnosed at a younger age, but can still occur at any age. And then in type 2 diabetes, it's usually associated with a higher weight, so being overweight or obese, and the onset thereof is quite gradual. So it doesn't happen overnight. It happens over quite a period of time, and by the time that you're diagnosed with type 2 diabetes, you've probably had it for maybe even a few years already, without knowing it. Yeah, but the major aspects that distinguishes type 1 from type 2 is that in type 1 you have an insulin deficiency, and in type 2 you have insulin resistance.
Okay, and then other than type 1 and type 2 diabetes, are there any other forms of diabetes?
Yes, there's actually quite a few forms of diabetes, but it's so uncommon that we don't really know about it. So, but it is there, it does exist. So I'll mention a few for you. But obviously, type 1 and type 2 actually type 2 is the most common form of diabetes, followed by type 1. And then you could get gestational diabetes as well, like I mentioned earlier, the diabetes that you have during pregnancy. Then you also get familial young onset diabetes, so that was previously known as MODY, or maturity onset diabetes of the young. You also get LADA, which is latent autoimmune diabetes of adulthood. I'll speak a bit about that just now. Then you get diabetes insipidus, and actually they are these days referring to Alzheimer's as a type 3 diabetes, so that's quite interesting. Yes, but then you also get diabetes related to genetic defects of beta cell function or insulin action, diseases of the exocrine pancreas, endocrinopathies, drug or chemical induced diabetes, infections leading to diabetes, and then other illness related diabetes. So yes, there's actually quite a few forms of diabetes, but I think the most common ones we are all familiar with. Then when we get back to LADA, the latent autoimmune diabetes of adulthood, it's actually a form of type 1 diabetes, but it presents as type 2 diabetes, and it's most commonly, or it's only diagnosed at a later stage in life, so only after 35 years of age, so not before that, and it's usually controllable on oral agents for up to 6 months, after which you will most probably then require insulin. And then for you to be diagnosed with LADA, you also need that genetic component that must be present. So that's why I say it's actually a form of type 1 diabetes. But yes, that's your different types of diabetes.
What are the symptoms of diabetes that we should be aware of and look out for?
The most common or classic symptoms of diabetes include frequent urination, excessive thirst, weight loss, mostly in type 1 diabetes, and then also hunger. So obviously there's a lot of other symptoms as well, but these are the most important ones to be on the lookout for. And if you do experience any of them, please go consult a doctor or healthcare professional. Then it's also important to note that type 2 diabetes may be asymptomatic, so you might not even experience any symptoms at all, and this is what a lot of times actually causes a delay in the diagnosis of diabetes, because the individual is actually not even experiencing any symptoms at all. Yes, but like I mentioned, the most classic ones are frequent urination, excessive thirst, weight loss in type 1 diabetes, and then hunger.
I just want to mention here that we don't want to scare anyone into thinking that they have some kind of problem if they have any of these symptoms now and then. I mean, we're all more thirsty and more hungry from time to time. We are just trying to create awareness because early diagnosis is always better. What can we do to lower our risks of becoming diabetic?
There's actually quite a few things that we can do to prevent or lower our risk of developing type 2 diabetes. Type 1 diabetes, on the other hand, is a total different story, and no interventions prior to the diagnosis thereof have shown any benefit. So at this stage, we cannot really do anything to prevent type 1 diabetes. However, when we look at type 2 diabetes, the major aspects include lifestyle, medication, surgery, and insulin. So the most important one is obviously lifestyle. So you need to manage a healthy weight. If you're overweight or obese, you'll have to lose weight to lower your risk of developing type 2 diabetes. You need to have a healthy, balanced diet, and then obviously also exercise to be physically active. Then when we look at medication, metformin, which is a diabetic oral agent, that's actually shown to also decrease the development, or lower your risk rather, of developing type 2 diabetes. Obviously it's not for everyone to use, but we will recommend it definitely in some cases to prevent diabetes. Then insulin, so you do not have to have diabetes to use insulin. If you have impaired glucose tolerance or impaired fasting glucose, insulin can actually help to prevent the development of diabetes at a later stage. And then I referred to surgery. So in this case, I'm specifically talking about bariatric surgery in obese individuals. So it has been proven that bariatric surgery can significantly lower your risk of developing type 2 diabetes. So yes, that is fortunate for us that we can do quite a few things to prevent the development of type 2 diabetes. But yes, like I mentioned, this is not necessarily the case for type 1 diabetes.
Is there a way to turn diabetes around, or is it a case of once a diabetic, always a diabetic?
Unfortunately, there is no cure for diabetes just as yet. So currently we are focusing on optimal blood sugar control and delaying or preventing the onset of diabetes-related complications, especially cardiovascular disease or heart disease in more common terms. But having diabetes should not limit you from living an optimal life. If you're able to manage your diabetes well, you can still live a perfectly normal life, participate in sport and whatsoever. Obviously it will require a bit of more effort and discipline and motivation, but it is possible. Quite a few interventions have been done to try and find a cure for diabetes, some of which include beta cell implantation as part of pancreatic or islet cell transplantation, gene therapy using implanted cells that's capable of producing insulin, stem cell derived beta cells, and then pancreatic transplantations and islet cell transplantations. But due to all of the limiting factors, it's making it quite challenging to use these interventions as a method of curing diabetes. Just to mention a few limiting factors, so for pancreatic transplantation, obviously we have the problem of donors, so lack of donors, and then also the need for lifelong immune suppression to prevent organ rejection. And then when we look at islet cell transplantation, we have a limited supply of islets. We have the side effects of the immunosuppression and also the eventual return to insulin dependence. So if you do get islet cell transplantation, you might be insulin independent for a period of time, but then you will eventually again require insulin. So all of this is making it quite challenging, and at this stage we can't really say that there is a cure for diabetes, but obviously we are working towards it, and in the future, I'm very positive that there will be a cure for diabetes.
I like what you said about not letting the fact that you have diabetes keep you from living your best life. Like Charles R. Swindoll, author of The Grace Awakening, said, "I am convinced that life is 10% what happens to me and 90% how I react to it." And then just one last thing, what other interesting facts did you learn at the forum that you can perhaps share with our listeners?
I attended the 21st CDE Postgraduate Forum in Diabetes Management, which was held on the 2nd to the 4th of August of this year at the Emperor's Palace Convention Center. So the CDE annually hosts this forum to give healthcare professionals an update regarding the latest evidence and research regarding diabetes. So they get national and international speakers to present, and that all of us can stay up to date. So the CDE is the Center for Diabetes and Endocrinology, and they're actually doing some amazing work for individuals with diabetes, especially in South Africa. But what I'm going to talk about now is actually not really focused on diabetes at all, but I found it really intriguing, so I really want to share it with you. And it's important to know that it was not presented on at the forum. They mentioned it during the closure of the forum, sort of like here's something to take home and go think about, but I found it really interesting. So I'm not an expert in genetics, and what I will be talking about is actually genetic modification. So the information I'll be sharing I got from an article published by a PhD student at Harvard Medical School, and the article was published on the Harvard University's Graduate School of Arts and Sciences website, and what I will be talking about is CRISPR. So this stands for Clustered Regularly Interspaced Short Palindromic Repeat. So it's quite a big phrase, but that's why I'll just leave it there. So let's talk CRISPR technology. So this technology has been successfully used by scientists in labs to make precise changes in the genes of organisms, such as fruit flies, mice, plants, and even human cells. Genes are defined by the specific sequences which provide instructions on how to build and maintain an organism's cells. So a change in the sequence of even one gene can significantly affect the biology of the cell and in turn also affect the health of an organism. CRISPR techniques allow scientists to modify specific genes, which is really incredible. With these early successes in the labs, we are actually looking toward medical applications of CRISPR technology, and one such application will be to treat genetic diseases, and that's where diabetes can fit into a bit, because like mentioned earlier, both type 1 and type 2 diabetes has genetic components or genetic backgrounds. So yes, if this technology can be used in the future to treat genetic diseases, it means that it might actually even cure diabetes in the future. So or prevent it, for that matter, even just prevent it from developing at all. So that's why it's so fascinating. And I'm not only talking about diabetes, but any genetic disease. So a study was done, and what they did was they replaced the mutant form of a gene with its correct sequence in adult mice. And by doing this, researchers demonstrated a cure for a very rare liver disorder that could be achieved with a single treatment. So of course, any new technology takes some time to understand and work properly. And although a lot remains to be discovered, there's no doubt that CRISPR has become a valuable tool in research. And in fact, there's enough excitement in the field to warrant the launch of several biotech startups that hope to use CRISPR-inspired technology to treat human diseases. So, yeah, this is very exciting news for scientists and healthcare professionals and the general population, because CRISPR might just be a cure for chronic diseases or genetic diseases in the future. So that was what I found really interesting at the forum, even though it was not really even presented on. But yes, I'm pretty sure other people will also find this very interesting. So thank you so much for having me today, and I hope everyone learned a bit more about diabetes. Yes, stay well.
Thank you so much for answering our questions and for the wonderful work that you do to make our population a healthier one. If you want to book online or one-on-one consultations with Petra, which includes nutritional assessment and counseling, dietary advice and personalized meal plans, as well as DNA analysis and gene-based meal plans, you can send an email to petra16lou@gmail.com. That's PETRA16LOUW@gmail.com. Or you can find her on the following social media platforms. On Instagram, it's @NutriCore_RD. And then on Facebook, you can find her under NutriCore. She now also has a website, nutricore.co.za. Before we say goodbye, I want to leave you with a little story that I deliberately left Petra out of to save her the controversy. My father was a type 1 diabetic for 10 years, which means he was fully dependent on insulin right from the start. But it was not a case of using insulin and moving on with his life. Getting the insulin right was a big struggle. He made use of 2 different types of insulin, rapid-acting and long-acting, which he would inject at different times of the day. Sometimes after using his insulin, his blood sugar would drop from above 10, sometimes 20 to 1 or 2, which was then again way too low. And there were many times that his sugar would drop so much and so rapidly that we couldn't get him to respond at all. Then we'd take him back to the doctor and they would decrease the unit he injected or change to a completely different type of insulin, which would have other side effects again. Long story short, there was never a day that my father's life didn't revolve around his sugar levels. I have to admit, though, that he wasn't always very strict with his diet, but he used to say that we wouldn't understand unless we were living in his body. 10 years later, he was diagnosed with stage 4 cancer, and after going through chemo and hearing the doctors say there's nothing they could do for him, we decided to try everything and we ended up getting our hands on medicinal cannabis oil. I'm not going to bore you with the details, but basically, as soon as my dad started using cannabis oil on a daily basis, his sugar levels stabilized so much so that he could stop using any form of insulin. And for now, I'm just going to leave it there. Quick disclaimer, I am not a professional and I'm surely not encouraging any diabetics to leave their medication and turn to cannabis oil. I am simply telling you my dad's story and leaving you with something to think about. Next month, however, I will be discussing this and other alternative healing methods with Nurse Dale from her professional point of view, so be sure to stick around if this topic spiked interest. And then before we go, I just want to thank our engineer behind the glass, Alex Mayberg, for dedicating his Sunday to record this episode. And I would also like to thank all the listeners who are tuning in. Have a balanced week and remember to be kind to yourself so that you can be kind to others too. Feed Me Honesty is a South African lifestyle podcast hosted by Hazel Priscilla and produced with the generous assistance of Blended Podcasts. Brought to you by Blended Audio.